right, I'm recording
I
just so
had
other people can
okay.
view this. Go ahead, Robbie.
So I had a question about the um these parts.
Oh, okay.
No,
It seems to be blurring it. I think you've got
yeah,
your blur
sorry.
on.
There we go.
Yeah.
This cell, like all these different parts.
Hmm.
Um, I'm confused with that, and I'm also confused of where the fimbriae ends and the ovary starts.
Okay, so we're going to go through those in the presentation. So I've got those on there. So let's just hold off on that. Does anybody else have a particular thing they want to go through?
Will we be able to ask afterwards as we
Yeah,
go
sure,
through?
absolutely. Yeah, we'll have some time. So I just want to go through and I've looked at the practicums this far, and definitely development seems to be one of the stumbling blocks for people. So I put that first in this little presentation, and then but yeah, I would go through there and watch the lecture on development. It's if you watch it, I think it's 20 minutes. You can watch it in double speed or something, but I think that would be helpful. Anyone else have any questions before we start this presentation? Okay, so if that's no other, let me see if I can get this started. Oops. Okay, and then I'm going to share this. Okay, so let me see. Can you all see anything popping up a screen or anything?
Yep.
Okay.
Yes.
All right. So this is sort of the early part of what goes on with embryonic development. We can tell it's an embryo because it doesn't look like a baby yet, right? What was a fertilized egg called? Does anyone remember?
Zygote.
Zygote.
Zygote. Yeah. So zygote. So we've already had a zygote. It's not shown here. We've gone through the process, the early process of cell division, which is called cleavage. And so we've got this sort of 8 cell stage that's on your left-hand side. And in the middle, what is that structure there called? This solid ball of cells.
Morula. Morula.
Morula. Okay, so that's the morula, and then that's going to continue to develop into this group of cells, the embryo that's at right. What do we call that?
Blastocyst.
Blastocyst. Okay, so the blastocyst is there. Number two, what you see there, that big inner cell mass, right? So the inner cell mass, ICM, that's going to become the embryo, the extra embryonic membranes. So three right there. What portion would that be? Anyone?
Inner cell mass.
So three and four together, or number two, is the inner cell mass, but it's already differentiated.
The epiblast.
Yeah, epiblast number three, hypoblast number four. So epiblast is going to become ectoderm and neural tissue, and hypoblast is going to become some of the endoderm. Number five is the blastocele, and number six, anyone tell me what that is?
Trophoblast.
Trophoblast. So this is something that's really important for providing nutrition to the developing embryo. We don't have much nutrition in the yolk sac. So number six, the trophoblast is going to become eventually the syncytiotrophoblast and eventually the chorionic villi, which will be part of the placenta, the embryo's part. Okay, so let's see. So now we've got another blastocyst. We can tell that it's further along because the cells are smaller, right? The process of cell division cleavage just makes the cells smaller for quite a while. So number seven is that membrane. It's the shell of this embryo before it hatches. Can anyone tell me what that is?
Zona pellucida.
Zona pellucida, it's the shell. Okay, eight is this first bag that we have forming. This is going to be the amniotic sac, later filled with amniotic fluid. Nine is this bilayered embryonic disc, and that's what becomes the embryo. And it has, again, the epiblast number 11 and the hypoblast number 12. Epiblast, again, becomes ectoderm and nervous tissue. The hypoblast becomes the lining of the GI tract. So 10, we can call it yolk sac, and 11 is, again, our trophoblast. Okay, and then we get further along. We've now burrowed down into the female reproductive tract. So the endometrium is completely covering the developing embryo. Number 34 is this decidua capsularis that's kind of covering the embryo. I don't know, the numbering is totally off here, excuse me. 13 is just endometrium. 14 is anyone?
That the mesoderm? I don't know.
It's not mesoderm. This is a lacuna. So lacuna, it's a lake of maternal blood in there. 15. Now this is one that's gotten a lot of people on the practice practicum.
Yeah, what is that?
Anyone? It used to be called the trophoblast, and now it's differentiated into this structure. So any idea?
Syncytiotropoblast.
Syncytiotrophoblast.
Hey.
Okay, hold on. I need to check the waiting room. Somehow, where is the waiting room? Admit all. Okay. Sorry, I didn't see them. Okay, so now I see some other people have come in, so I just need to keep watching that waiting room. So yeah, number 15 is the syncytiotrophoblast. This is, again, it's going to become part of the embryo or the fetus's portion of the placenta. 16, anybody have an idea what we would call that?
Archenteron?
Archenteron, yeah. So archenteron, that's fine. Yeah, so it's just a cavity in there. And what about number 31? This is not labeled up there, but what would you call that? So these are just some of the endometrial glands, and some of the, sections you would see this basically reaching the surface of the uterus, and so that would secrete things like glycogen and stuff like that. So endometrial glands. Let's go and see what's next. Okay, so this is just a different picture. We're at day 14. Again, 17 is our endometrial gland. 18, what is the space around here going to be called?
Extra embryonic column.
Yeah, it's the blastocele extra embryonic membranes. 40 right here is technically the amniotic sac, so it hasn't gone around. So something like that, extra embryonic membranes. I'm going to grade these by hand after the auto grading, so I'll accept a variety of things. 19, this finger-like structure was once part of the syncytiotrophoblast, but now it's differentiated. So what do we call number 19?
The chorionic villi.
Chorionic villi. So yeah, this is one of the things we do fetal testing. If we're worried about Down syndrome or something like that, we can actually stick a needle in there and pull a portion of that away, and that's going to allow us to examine the embryonic cells or fetal cells.
Is the correct wording, sorry, real quick, is the correct wording a villi, or is it villus is okay, or is
Villus is singular, and again, the auto grading might count you wrong on one thing, but when I go and hand grade that, I'm going to catch that. And yeah, I know some people, when they've got their practice practicums back, I did send a rash of them out without hand correcting, and that was my fault. But I will definitely hand correct everything that's submitted for the actual practicum, and I'll definitely hand correct anything that's submitted today and stuff like that. I missed something. One note while we're on that is some people have been, when they put the practicum things in there, they'll put in a few different words, and they'll say, oh, ductus deferens or vas deferens. And both of those are correct. And so that's a correct answer. The autocorrect counts it wrong, but I'll count it right. But I wouldn't suggest putting more than two terms in there, because if one of those two terms is wrong, the whole thing is wrong. So I would just suggest choosing your best one and putting that in there. Because yeah, you could, put in the right term and then put in the wrong term. It's still going to be wrong. So I would suggest one term. Okay. And then, yeah, see, Em just posted a Khan Academy video that should be helpful. All right. Number 20. What was that structure here in the embryo?
Neural plate.
Neural plate, yeah. So this is eventually going to become the neural tube, which will become the nervous system. Underneath the neural plate is number 21. This is a very important structure. What is that?
the nodal cord.
What's that?
Is it the nodal cord?
Notochord, yeah. So that's like a cartilaginous rod. It's like a primitive spine, but more importantly, it also sends chemical messengers that help to induce the differentiation of the structures around it. 22, what kind of tissue is that in there?
Mesoderm?
Mesoderm, yeah, mesoderm. So what kind of tissues does mesoderm become?
Um, Connective tissues, muscles, and bones.
Correct. Connective tissues, muscles, and bones. Ectoderm becomes nervous tissue. It becomes the epithelium, and endoderm becomes the lining of the GI tract. Okay, so we're further along. We're now into the fetal period. We can tell it's a fetus because it doesn't look like a space alien as much. We can see a head and arms and legs and fingers and stuff like that. 23 here. What is that called? Where are we at?
That's
Myometrium?
Myometrium. Yeah, 23 is a myometrium. Endometrium would be where like that 33 is. And there's different parts of the endometrium. So, but 23 is myometrium. 24 is what?
Yolk sac.
Yolk sac. Okay. Yeah. Number 25 is what?
Umbilical cord?
Umbilical cord. 26 is just the fetus. 27 were those structures that were initially part of the trophoblast. And what were those called?
Chorionic villus.
Chorionic villus. Okay, 82. I don't know. I got weird with my numbering. What was that structure called?
The pseudocapsularis. Capsularis?
Yeah, the decidua capsularis. And decidua just means to fall away. So this is the capsule surrounding the fetus. And decidua basalis would be down where 33 is, which is next to 23. But decidua capsularis is that part of the endometrium that's covering the capsule, that's covering the amniotic sac. Okay, and that brings us to this placenta model. And, the parts on there that you have to recognize, 28 is your umbilical arteries and veins. I'm not really going to make you differentiate it. 29, what was that structure called?
Chorionic plate?
Chorionic plate. And 31 would be what? We're looking at this sort of broccoli-looking structure.
Villus.
Chorionic villus again. And 30 is just these intervillous spaces, which is filled with maternal blood. Other things that are down there, those little blood vessels, we have our spiral arteries and veins and stuff like that. And yeah. Okay, so that is quick and dirty. Oh, no, we still have this embryo that I put in the wrong spot. So let's look at the ones. We've already talked about 32 is the yolk sac. 33 is umbilical cord. What is 38?
Ear hole.
Optical nerve.
Optic vesicle. Yeah, optic vesicle. And so there's a optic vesicle. There you see the olfactory pit where the nose would be. 37 is one of the pharyngeal arches. Which one do you think it is?
Maxillary process.
I think that's mandibular. Maxillary would be the bump above it. So that should be the mandibular process. And then below that would be the hyoid. And what is number 36?
Heart.
Heart. Okay. And what about 35?
Arm bud.
Yeah, it's the arm bud. And 34 would be a what?
Hail to an alien.
It's a segment. So what's the word for segment? Somite. Yeah. So or a sclera, but yeah, somite, just a segment that we look through there. So it's a segment. All right. And that's, it's not everything that's on the development, but those are the really important ones. And so, yeah, I would definitely say go through, review development based on the practicums I've seen so far. That's where people are having the most trouble. Okay, up here in 39, we're in the male reproductive tract. What is this part of the penis called?
Glands.
What's that?
The glands.
Glands, good. Okay, glands. 40, I guess I'm pointing at the penis. What is 41, that blood vessel?
Deep dorsal penile vein.
Yeah, dorsal penile vein is fine. 42, this is some of the erectile tissue. What is that called?
Corpus cavernosa.
Yeah, corpora cavernosa. Or corpus cavernosa is singular. Again, singular plural. I'm not going to get you on that. There are two bodies in there, but I will, hand correct that. 43, we have the penile urethra. And what kind of erectile tissue is surrounding the penile urethra?
Spongiosum.
Yeah, corpora spongiosum. So you can just call this a spongy urethra too. 44, what is that structure there?
Testes.
Yeah, testis is singular, testes plural, either one's fine. 45, this is where the sperm is stored prior to ejaculation.
Epididymis.
Epididymis. Okay, good. 52 down here, the skin surrounding the testes.
Scrotum.
Scrotum, good. Going back up to 46, what is that weird looking thing?
Pubic syphilis.
Pubic symphysis. It's just part of the pubic bone. 47 is the bladder. 48, where are we at?
Prostatic urethra.
Prostatic urethra. Okay, so that's where it goes through the prostate gland, and that's where men, as they get older, have that impingement. So 49 is just the prostate gland. 50, what gland is that?
Ovourethral gland.
Bulbourethral gland or Cowper's gland is fine. And 51, what is the skin between the anus and the scrotum called?
Perineum.
Perineum. Yeah, some people have been writing perineurium, which is, type of connective tissue surrounding a nerve, but perineum there. What gland have we not labeled in this model? We can't really see it, but there's another accessory gland on males. I heard somebody saying something, but I didn't quite make it out. Okay. On the backside, there should be some seminal vesicles back here. We can't really see them, but that's one thing I should have shown a model, but those could potentially be on there too. They're on the backside, seminal vesicles. Okay, female reproductive tract, starting up with 53. What is that structure called?
Fallopian tube.
Fallopian tube. Okay. And then, Robbie, you were asking about the infundibulum and the fimbriae. I don't have a picture of it right here, but the infundibulum is the funnel that comes off the tube, and the fimbriae are, distal to that. So oftentimes I'll take one or the other, but yeah, if I'm pointing at the finger-like structures, those are going to be fimbriae.
Yeah, I think I asked that because I answered it and what I thought it was right. And it wasn't, and that's why I was like, oh, maybe I'm confused. And I think it's just because in the model that we are working off of, on that particular diagram, it's like blurry.
Yeah. Yeah, and this one I
kind of
wouldn't
like feeds into, it doesn't really separate.
Okay. This one I wouldn't, I probably wouldn't ask fimbriae on there because I can't really see the infundibulum on there. But yeah, there's that other like model from the 1970s that I can use.
No doubt.
61, what was that structure there?
Cervix.
Cervix. And 54 was the what?
Fundus.
Fundus of the uterus. Yeah. So uterine fundus. Be sure there to say that it's uterine fundus and not just fundus. 55, what was that structure?
Urinary bladder.
Urinary bladder. 39 is the urethra. 57 is what?
Labia minora.
Yeah, so 57, labia minora. 58, labia majorum. 56 is the what?
Clitoris.
Clitoris. Okay, and 60 is what?
Perineum.
Yeah, perineum again. And 59 is just the vaginal canal. So I know there's a lot more complex stuff on there, but I didn't put much on here because you all seem to have the female reproductive tract down based on the results of the practice practicums. Okay, so this is one that gave people a little bit of trouble. 62, 63, 64. What stage are we at right here? 62.
Oh, no. Primordial.
Primordial, follicles. Yeah. What is 63 then?
Primary follicle.
Primary follicles. And what about 64?
Antral follicle.
Antral follicle or Graafian follicle, that would be fine too. It's got this fluid-filled antrum, so that's how we tell that apart. In 65, if I just say this is a process, what process is going on?
Ovulation.
Ovulation. What hormone causes ovulation?
LH.
LH, good. So after ovulation, the oocyte, which is this down here, D, is going down the fallopian tube. And then what does this ovulated ring of cells become?
Corpus luteum.
Corpus luteum. So, 66 is corpus luteum. This is now corpus luteum 2. And the corpus luteum is important because it secretes what?
Progesterone.
Progesterone, which maintains that uterine lining. Eventually, that corpus luteum 66 is going to break down and become this white body, which is what's another name for that white body?
Corpus albicans.
Yeah, so it's the albicans, the corpus albicans. It no longer secretes progesterone. And so what organ is secreting progesterone at this point to maintain the uterine lining?
Ovary.
Not the ovary. So it's no longer the ovary. So what is secreting the progesterone? And this is more of a lecture question, but I want to touch on it.
Is it the placenta?
The placenta, yeah. So normally the corpus luteum, its progesterone secretion is going to wane as it becomes a corpus albicans. And ideally, the placenta is carrying on production of progesterone. If it doesn't, this is a sign where we can have a miscarriage because the uterine lining isn't maintained enough. Okay, some histology here. What kind of follicle was this?
Humulus oophorus.
No, just the general name for the follicle itself. Is it a primary, a primordial? It's an antral follicle or Graafian follicle. So 69 is that fluid-filled antrum. What is 68?
Granulosa cells.
Yeah, so granulosa cells, there's some other, on the outside, we have the thecal cell layer, but this is the follicle itself. So I'll take a variety of answers there. 70 is actually the oocyte, and 71, I think that's what you're talking about, Robbie, was a cumulus oophorus that's surrounding that oocyte.
Sorry, I have a quick question.
Sure, go ahead.
With the last slide, I know there's a question that was on the practicum, and it was like, what is these two stages or something like that, and it was E and F. So were we just supposed to write ovulation and the corpus luteum, or was there something else that you're looking for? Because I kept getting it wrong, but I wasn't sure.
Okay, yeah, and I can hand check that. So as a process, E is ovulation, and then as a structure, we would call the leftover part the corpus luteum, if that makes sense. I don't think I got you on there on the practicum, but if you wrote ovulation on the practicum, or if you wrote corpus luteum, I would take that too. But the leftover ring of cells is the corpus luteum. The process is ovulation.
Okay.
Okay.
Thank you.
All right. So then what are we looking at here? We're looking at the testis. What are these structures called? The functional unit of the testis?
Seminiferous tubules.
Seminiferous tubules. And yeah, so make sure you spell things right. You get partial credit if you misspell things. But yeah, you want to make sure you spell that correctly. 72 is the area outside the seminiferous tubules. And I've been looking at this particular group of cells. What could I call these cells?
Interstitial Leydig.
Yeah, interstitial cells or Leydig cells. And that's one where you can put both names, but honestly, just choose one. That'll probably be easier on you. And then the lumen of the tubules, I don't know if you can see where my arrow is, but the hollow parts is where you can see the tails or the flagellae of the spermatozoa. Okay. All right, so that brings us to the kidney. Any questions so far?
No.
Okay, let's look at vasculature of the kidney because this is one that's a little bit tricky. So coming in, this red vessel, number 72, it's an artery. What is the name of that artery?
Renal artery.
Yeah, it's the renal artery. And then 73, it branches off, now it has a different name.
Segmental artery.
Segmental artery. And 74,
That's the one I always forget. Interlobe.
Lober.
interlobar. It's between the lobes. It's between the lobes. So interlobar artery and vein. 75, it's now making a turn or an arc. What is it called?
Arcuate.
Arcuate arteries or veins. 76, these little finger-like projections of those blood vessels. What are those called?
Cortical radiate arteries or
Yeah,
veins.
cortical radiate arteries and veins. And then 77, these are blood vessels as well. If I'm, pointing to these little things that are sort of going together like that, what would those blood vessels be called?
Peritubular capillaries.
Very good. Peritubular capillaries. So that's where we do that process of reabsorption. Okay. 78. So now we're just talking about tube coming into the kidney. What is that called?
Ureter.
Ureter. Okay. And then it empties into this big sort of hollow space. What is that place called?
Renal pelvis.
Renal pelvis. 80. What was this structure?
Major calyces.
Major calyx, and 81 is the minor calyxes or calyx. So 81, there's two of those, right? Two minors merge to become a major. And then 82, I don't know if I have any. Oh, 82, what would this structure be called? Just the sort of orange wedge shape.
Pyramid.
Yeah. Renal pyramid. And then what is the tip of the pyramid called? I don't have it labeled right here.
Renal papilla.
Renal papilla, good. 83 is the in between the lobes here. So what do we call that part of the medulla? Yeah, renal columns there. So renal columns, that's another one that people haven't gotten right.
Yeah, me.
Okay. All right. So going back in, first of all, what were these blood vessels that are going from top to bottom of the screen right here? Can you see my pointer? I don't know if you can or not.
Is that the arcuate?
Yeah, that's the arcuate, and then we have our cortical radiate. But here we're looking more at parts of the nephron. So let's start out with number 87. What was that structure called?
Glomerulus.
Glomerulus. And what process happens in the glomerulus? I think someone got cut off. So there's three processes. There's reabsorption, filtration, secretion. Which one goes on here?
Filtration.
Filtration, good. So stuff is forced out of that capillary bed. It then enters 89, which is the what?
Bowman's
capsule.
Bowman's capsule. And 89 and 90 together, if we're referring to them as a unit, what other term can I use? So the glomerulus plus the capsule equals the renal
corpuscle.
Renal corpuscle, good. 86, this is the first part of that nephron tube. And what is that called?
proximal convoluted tubule.
Proximal convoluted tubule. And for those of you in the lecture class, what things are reabsorbed at the proximal convoluted tubule? Bueller, anyone?
Oh, H2O, glucose, amino acids.
Right. So 65% of the water, the glucose is reabsorbed here. It's the only place we have glucose reabsorbers. So If somebody has really high glucose and it goes past there, it's going to stay in the urine, which is abnormal. But yeah, water and glucose and other things. 84 is the loop of Henle. Now, going down on this side, it's the descending loop of Henle, which is permeable to water, and then going up is the ascending permeable loop of Henle, which is permeable to salts. Okay, and then 88, if I'm pointing to this convoluted tube, which tube is that?
Distal convoluted tubule.
Distal convoluted tubule. Okay, good. 85, what is this structure called?
Collecting duct.
Collecting duct.
Collecting duct. And why is the collecting duct really important? What happens here?
It's adjusting how much water will be in the urine.
Good. Yeah, how much water is reabsorbed back into those peritubular capillaries, and what hormone controls that?
ADH.
ADH, good. 91 up here is just the renal cortex, and then the capsule is sort of the brown thing on the outside of that. Okay, now we're looking at this close-up view of the renal corpuscle. 92 is the what?
Macula densa.
Macula densa. 93 is what?
Afferent arterial.
Afferent arterial. 94 is efferent. You'll see them switched on various illustrations. So I'll accept either afferent or afferent because it could be one or the other based on the orientation. But I always refer to the top one as efferent just to make, or afferent if it's coming in, efferent is going out. 95 is our glomerulus. And then that glomerulus is actually covered by these cells right here. What is 97?
Podocytes.
Podocytes. Yeah, podocytes. 96, what was that capsule that surrounds the glomerulus?
Bowman's capsule.
Bowman's capsule. And 98 is the first part of the renal tubule. It's going to be the what?
The renal tubule.
But what's the first part of the renal tubule called?
Proximal.
Yeah,
Convoluted.
proximal. So yeah, on there, if I ask you specifically, you say that's part of the proximal convoluted tubule. Okay, urinary bladder here. 99 is the what?
Trigone.
Trigone. 100.
The uteric orifice.
So yeah, but ureteric, you are,
uteric.
Yeah, so think of the word ureter and teric, ureteric orifice, because if you write uteric, that kind of sounds like uterus. And so you want to get that spelling right. And I do that too. I screw it up all the time.
Ureteric.
Ureteric, yeah. So write ureteric orifice, and that'll get you there. What was 101?
The bladder neck, urinary.
Bladder neck, or if you gave me the sphincter there, that would be okay too. 102, what part of the urethra are we in?
Prostatic urethra.
Prostatic urethra, good. Okay, any questions so far?
Sorry, what was 100 one more time, please?
100 was the ureteric orifice, ureteric orifice.
Okay, thank you.
Okay. Digestive tract things are, sorry about this image. I basically didn't have time to finish renumbering everything. 1, what would that structure be?
Hard palate.
Hard palate. 2 is the tongue. 3 is the liver. 4, I don't know what I'm pointing at. So I'm not sure what I was pointing at.
Is that the right lobe?
Yeah, maybe I was looking at the right lobe there. 5 is this green structure there. What is the what?
Gallbladder.
Gallbladder. 6 is this particular area of the stomach, the outside, this curve right here. What is that curve called?
Minor curvature.
Lesser?
The lesser curvature. Yeah, lesser curvature. Okay. Number 7, what loop of the small intestine am I in right here?
Duodenum.
Yeah, duodenum or duodenum. Number 8, what part? Don't really ask. Let's assume I was just saying, what is this major part of the large intestine? What would you say?
Ascending colon.
Uh, yeah, so that would be ascending because it goes up from here. If I'm pointing to this particular pouch, what would I call that pouch?
Ostra.
Ostra. Okay, number 10, this is a junction. What is this junction called?
The iliacal valve.
Yeah, ileocecal valve. Ileum because this is the ileum here. Cecum because this is that pouch. So 11 is the cecum. What is this little thing down here, number 12?
Appendix.
Appendix. Good. All right, going back up to number 13. First of all, if I point to these hard things above number 13, what would they be?
Nasal conchae.
Nasal conchae or nasal turbinate. So I'm not going to make you differentiate superior or inferior or anything like that. Number 13, what would you say that area is?
Nasopharynx.
Nasopharynx, good. Number 14, what is this structure?
Soft palate.
Soft palate, good. 15, part of the larynx.
Epiglottis.
Epiglottis. And 16, part of this tube going down here. What do we call that tube where the food goes?
Esophagus.
Esophagus. Okay, 17, I think I was pointing to this, general area up here. What would I call that area?
Fundus.
The fundus of the stomach. Good. 18 is a constriction right here, a valve. What valve is that?
Cardiac sphincter.
Cardiac sphincter. 19, we're talking about this particular curvature of the stomach. What is that?
Greater.
Greater curvature, right. What hangs off the greater curvature?
Pancreas.
The greater omentum, the fat flap, yeah. So, which is never really shown in these models because it would cover up a lot of different things. But that's where the greater omentum hangs out. Number 20, there's another valve right here. What is that valve called?
Pyloric sphincter.
Pyloric sphincter, good. 21, this is an endocrine and digestive organ.
Pancreas.
Pancreas, good. 22, we have this sort of area where it curves from our transverse colon, which is 23, down to our descending colon. So what is that area called?
Splenic flexure.
Yeah, splenic flexure. What was the flexure on the other side called?
Hepatic.
Hepatic flexure. Okay, 24 going down was descending colon. 25, I think we were back in the ileum again. So remember, we had the duodenum somewhere there, it becomes the jejunum, and then the ileum down below. 26 is the what?
Colon.
Rectum.
Rectum. And 27 is the what?
Colon.
Anal canal or anus.
Yeah, something anus, anal canal, anal sphincter, something like that. Actually, anal canal. The sphincters would be on the outside here, which you can see there's an internal and external sphincter. I don't, quiz you on those. Okay, 1, we already saw hard palate. 2, tongue. 3, what was that structure there?
Common bile duct.
Common bile duct. What was number 4?
Falciform ligament.
Falciform ligament. Good. Number 5, we've seen this before.
Cardiac
so valve. The cardiac sphincter. Yeah. Number 6, what was this area up here called?
Lesser.
Lesser curvature. 7 is our pancreas. And 8, what part of the intestine am I in now?
Duodenum.
Duodenum. Good. Okay, 9, what part of the colon?
Ascending.
Ascending. 10.
Transverse.
Transverse. 11, what is the pouch called?
Haustra.
Ostrum or hostras, plural. 12, what part of the intestine am I in now?
Ileum.
Ileum, good. 13, what structure am I looking at? What histology?
Is it the liver?
It's not the liver. Liver is number
Pancreas?
14. That's the pancreas. So we saw all this acinar or acinar tissue that secretes digestive glands. And then in the middle of the pancreas, there's this weird structure that is endocrine. And what was that structure called?
Islets of Langerhans.
Yeah, the islets of Langerhans. Good. So 14 here, this is liver. And you can see it's kind of divided into, a heptagon or octagon, something like that. And that is pretty characteristic of liver. Okay, we're almost done. Respiratory tract. What was number 1 there?
Hyoid.
Hyoid. So hyoid bone. Number 2, what cartilage do we have?
Thyroid.
Thyroid cartilage. Number 3, the
Cricoid.
cricoid cartilage. Okay. And number 4, what was that gland surrounding the larynx?
Thyroid.
Thyroid gland. Good. Okay, number 5, what was that flap called?
The epiglottis.
Epiglottis. And number 6, one of the most missed questions on quizzes and on the practice practicum. What is the hole called? This cavity in here?
Glottis.
Glottis. So that's the glottis. If I'm 6, on this side would be misleading because it looks like I'm pointing to a structure, but this hole in here is the glottis. Number 7, what is this thing called?
Vocal fold.
Vocal fold. Okay. Number 8, what cartilage were we looking at?
Cricoid.
That was the thyroid cartilage. And number 9, what cartilage was that?
Cricoid.
Cricoid. And it's cricoid up here. There's a small part, but in the back, there's even a bigger part. So don't get that confused because these cartilages are pretty circular, right? They go all the way around. So this is both the cricoid, both in the front and the back. Number 10, what is the name of the tube?
Esophagus.
Not esophagus.
Trachea.
Trachea, good. Okay. Esophagus, good question, would be back here. Remember, the esophagus is normally collapsed unless we're actively swallowing something. So if it's held open by cartilaginous rings, it's going to be the trachea. Okay, 11 here. What were those structures, those hard structures up in the nasopharynx called? We're up in the nasal cavity.
Nasal conchae.
Nasal conchae or nasal turbinates. Number 12, I think I'm looking for nasopharynx. 13, we talked about with soft palate. What is 14 if I'm just talking about a general area?
Oropharynx.
Oropharynx, good. Okay, 15, this tube with the cartilage rings.
Trachea.
Trachea. And then it comes down to a sort of triangular structure down here, number 16, where the bronchi branch off. What is that area called?
Carina.
Carina, C-A-R-I-N-A, good. 17, what is this structure that branches off the trachea?
Primary, first degree.
Yeah, so it's primary bronchus. And to get the full points, you need to say primary left bronchus, right? Because a minute you're going to be medical professionals, going to say the person has an occlusion or a tumor and is primary left bronchus to differentiate it from the right bronchus. Number 18, 17 was primary, 18 would be secondary left bronchus. And then 19 here would be tertiary, right? Because it's branching off, assuming it's, yeah, it looks like it's branched before. So tertiary. Number 20, what is the name of the lobe there?
Superior.
Yeah, right superior lobe. Below that lobe would be the middle and then the right inferior lobe. 21 is a line. What is that called?
Horizontal fissure.
Horizontal fissure. What about this fissure over here on the other side?
Oblique.
Oblique fissure. Okay, 22, this white part down here, what is that called?
Diaphragm.
Tendon.
The whole structure is the diaphragm. This particular region is the central tendon of the diaphragm. So, you can put central tendon. That would probably be the best answer. But as a whole, it's the diaphragm.
Gotcha.
Okay, we're looking at some histology here. of the trachea. Let's start with number 25. What are we looking at?
Submucosa.
I'm sorry?
Submucosa with a question mark?
That is not submucosa.
Hyaline cartilage.
Hyaline cartilage. Okay.
Yeah.
24, what would that be? Give you a hint, it's glandular.
Submucosa layer.
The best, yeah, submucosa, it's seromucous glands right here. So seromucous glands would be the best answer. 23, what is the layer that's lining the trachea called?
Pseudostratified. Something.
Yeah, pseudostratified columnar is part of the mucosal layer, so either one of those would be okay. So pseudostratified ciliated columnar, you can see the little fuzzy stuff, the cilia on there, and then the big wad of snot that's being driven down there. We've got that ciliary ladder that's just pushing our mucus along. Okay. All right, and then if we're looking, this is the lung. Okay, what are these little bitty, I don't know, sacs of air called in here?
Alveolar sacs.
Yeah, alveoli, alveolus, something like that. And that is what I have for sort of the review presentation. Now I want to see, what questions do you all have? Does anybody have anything in particular they want to go over? I'm going to figure out how to stop sharing, which I still can't. Anyone?
Yeah, actually, I have a question.
Okay, go ahead, Ren.
What was 30? I think it was 32 on
On
this practicum.
On the practice practicum. Do you have it? Can you share it with me? I don't have a blank form I can share with anybody. So you are more than welcome to share if you have your results. You can share it with me, but I unfortunately did not prepare a blank form
On the
go through.
Socratic, number 32?
Yeah, it was pointing
Round
at
ligament.
was
Round
it
ligament. It holds
round?
the uterus.
Yeah, Rob, can you have your thing? Can you show it to us, what you've got on your...
I can't see myself because you're sharing, but
Okay. Oh, now somebody's sharing right now.
hey, there we go.
Okay, good. Excellent.
Yeah,
Somebody
thank
knows
you.
what they're doing. Yeah, so 32 is the round ligament. Good.
Round ligament?
Round, because it's round. Yeah.
Oh, okay. I put broad.
Yeah, broad ligament is actually a broad flat ligament in there. It's best, it would be below it right there. It would be part of the broad ligament.
Okay.
And I think there's another model that shows the broad a little bit better, but that is definitely the round ligament.
Okay.
So that was the photo I think that I was working on that had me confused. See how it says number 1? Is that the fimbriae or the ovary?
Number 1 is the ovary. That's a good point.
Okay.
Yeah. And number 3, that would be the fimbriae or the infundibulum. I'd accept either one.
Gotcha.
Okay. What else do people want to look at? Yeah, definitely be able to put those stages in order. I saw, M, can you go back to that one where there's those stages of the development? And it shows like 7 or 8 stages. Yeah. Okay. So which one of those is first?
F.
F. Okay. And then after that, what is
What number
next?
is this one? B.
I can't see the number. M can tell us what number that is. 18. Okay. Thank you. So F would be the first one. B, we're looking at, early 8-cell stage. What's after that?
G.
B. Bravo.
So we said F, B is in Bravo. G is
Golf.
next, right?
Yeah.
As in golf. What was that stage called?
Morula.
Morula, solid ball of cells. And what's after the morula?
D.
D.
Blast.
Delta.
Delta is the blastocyst. So I have to write down which ones I've used right now. So you will be able to have, so we said, so far we're F, B, G, D.
A.
So A is next. I would agree with that. So we're looking at a blastocyst that's implanted. What would be after A?
Echo.
Echo, right? So now we can see not just the epiblast and the hypoblast. We've got 3 cell layers, right? We've got ectoderm, endoderm, and mesoderm. So what process has E gone through? So initially we just had ectoderm and endoderm up in A, which is our epiblast and hypoblast. What happened between gastrulation? Okay, so we go from A to E, and then what's the next one?
Charlie.
Charlie. So that's a late stage embryo in there. We can see the somites, we can see the postanal tail, the limb buds, and stuff like that. And then our last stage there is the H, right? The fetal stage. So yeah, be able to put those in order, and that's a tricky one. Any other questions? Nobody else has something they want to go over from the practicum?
What was that layer on the male bladder that was towards the front, underneath the detrusor muscle? It's like that smooth layer on
It's
the.
like a muscularis. Is that what you were talking about?
Is that what it's called?
Yes.
It's like that flat, striated looking. It looks like a muscle.
So or detrusor or something like that.
It's
I think it was more on the urinary model. I think that's where that was.
yeah, it's just a cross section with the prostate at the bottom. It's kind of right to the left of the urethra opening.
Yeah, so I would something muscular, whether muscularis, detrusor muscle, I'll accept any of those.
Muscularis, I think.
Yeah. Any other questions? Yeah, I think that was the one down below.
Mm-hmm. That
So
one.
there it's showing the trigone. But yeah, just if you put
Trigone?
Trigone is the triangular region up here, but the muscularis layer is going to be below that, where you see it's kind of meaty looking. That's going to be the detrusor, various bladder muscles.
Sorry, I'm totally blanking. What is this one again right here?
Ureteric orifice, ureteric orifice. Yeah.
Okay, thank you.
Sure.
Oh, and then for 75,
Okay.
that's the test strips.
Sure. Yeah, let's take a look.
Sometimes I
All
get
right.
confused.
Okay, so let's go from the bottom up. We're not worried about ascorbic acid, except that if you take it, it can throw the other tests off if that's positive. So what we see is the leukocytes. Well, it's a different color, but let's assume that might be positive. That could be UTI. Specific gravity, we're not worried about so much. Tell me about the pH. What is the pH right now? 7. It's a little, it's neutral, and that's kind of unusual, except in vegetarians. But we also see it in a UTI that as those bacteria are in there that convert one nitrogenous weight and the other, it's either nitrite into nitrate or vice versa. No, I think it's nitrate into nitrite. Then that's an indication. And your real telltale is your nitrite right there. Your nitrite is showing a positive there. So that would indicate a UTI. Other unusual things that are in here are protein. It's showing protein in there. And I think we were using fake urine to do this. So protein would be abnormal too. We wouldn't expect to find that in urine. Ketones in urine, if they're positive, what could they indicate?
Ketosis.
Ketosis, ketoacidosis. If we saw ketones and glucose together, if we saw a positive glucose test, what potential diagnosis could you come to?
Diabetes.
Yeah, diabetes mellitus. Okay, good. All right, other questions?
So if it's the leukocytes and the nitrite, then it would be a UTI.
Absolutely, yeah.
Okay. Yeah,
I
thank
Go ahead. Is another question?
I have a question. I think it's number 19.
Okay.
It's the male reproductive system. I just wanted to confirm, is that the deep penile vein? Because I was
Uh,
putting the corpus
Corpora,
cavernosa.
corpora
let's
cavern. That's what I got.
19.
I got it
No,
right.
that's the corpora cavernosa. If I marked it wrong, it was, yeah. So there's an autograde on there, and the autograde was probably corpus cavernosa, and you put corpora, which is fine. So as I was sending these out to try to get people input, I might have missed correcting those, but that's definitely the corpora cavernosa. You know, the penile vein on there is a vein, and it is going to be superficial to that. Other questions? All right, if there's no other questions, I'll go ahead and cut it off there. You're welcome to send me a text. If you have a question, just take a snap in there. And I would suggest text right now because you want to get input right away about other questions that are on there. I'm not, nobody's asked me so far, what are all the answers to the practicum? I won't do that. But if you have particular questions that you're like, why did I get this wrong or something like that, I definitely will answer those by text would be the most expedient way. All right. I
Are you
appreciate.
posting this recording? Sorry, are you posting this recording somewhere?
Yes, I'm going to try to post it after I'm done. I'll let you know where that goes. I haven't done recordings with them before, but yeah, I will post it and I will send out an announcement on Lamaku, so you'll be able to see where that is.
I have another quick question.
Sure.
I know that the end of today, this will be closed, the practicum will be closed for a
Yeah.
grade, but will it still be like, can I still go in it though and like retake it, but it's not going to be graded, or will it just like completely
I'm
be
gonna close it out, yeah,
Okay.
because it gets too confusing. So yeah, be sure if you're gonna take it, take it by 11 p.m. tonight, because otherwise I have a hard time. There's no timestamp on these, and so somebody could say, oh, I took it, so I have to close it down at 11. So be sure to take it now, and make sure your best attempt is your last one. And for everyone that has been the case as I watch them, but I thought it would give me, all your attempts, like if you took it 3 times in a day, that I would see 3 attempts for you. But what I am seeing is the most recent attempt. So that's why I've been shutting it down every day, saving those results. And I just keep monitoring to see which grade is your highest grade.
Okay.
Any other questions? Okay, well, thank you for coming, and I will post this and send out an announcement. So remember, your practicum is due this week, and you have up to 4 p.m. Friday to take it at the testing center. And I think you have 90 minutes. All right, I'll see you all later. Thanks for showing up.
Thanks, Russ.
Thank you.
Bye.